and welcome back to Dr. Drill's Making Motivation podcast. I am Dr. Aaron Oberst, and this is going to be the first of many segments that we're going to be tackling week by week on your health, your spine, chiropractic care, common conditions that we treat here at Healthy Balance, what have you. So today we're going to be talking about your intervertebral disc or your disc. You think about slipped disc herniations, back pain, sciatica. All these little terms are inherent to this common condition. But first, let's start with some basic anatomy. Behind me, you can see that there is a spinal model. Okay, so check this sucker out. Down here, you can see we've got our tailbone terminating with our coccyx. You've got your hips, your pelvic joints here. From the posterior, you can see it. That's right, it's not from the back, it's the posterior. So this is your posterior, this is your butt cheeks right here. And here's your tailbone. And here's your low back. There's 5 lumbar vertebrae. There are 12 thoracic vertebrae, or mid-back vertebrae. And then there are 7 bones that comprise your neck or your cervical spine. So cervical, thoracic, lumbar, sacrum, pelvic joints. These are the bones that you sit on right here. They are called your ischial tuberosities, and I'm perched on them right now. From the front, there's your pelvic basin, your pelvic outlet. And you can see everything from the front view right there. The yellow structures that are coming out the side, right here, for instance, these are your spinal nerves, and you can see they come out both left and right, and they're coming off of the spinal cord. And of course, your brain would be up yonder. Yes, yes. So here is a look, a zoomed in perspective on your low back vertebrae. So in the back here, you've got your spinous processes, and this is the way that I'm positioned right now. So the front and the back, you got these little spinal bones that we can feel when we run our fingers back there. All right. And then we've got these things come out the side. They're called the transverse processes, and muscles will live right in these gullies right here, right in here, in here. Paraspinal muscles, they call them the erector spinae because they're the spinal muscles that help us stay erect. So these are the features of your spinal bones or your vertebrae. The spinal cord is down the center, and then these kind of translucent structures that are sandwiched between the vertebrae are called the discs. That is the subject of today's conversation, okay? In the center of the disc, you can see this little structure here that's going to be akin to like the jelly in a donut. And then we've got these layers that go around the periphery. Imagine like slicing an onion and looking at it. You've got those concentric circles. So think of the discs as little shock absorbers, and they are positioned, as you can see in the extended spinal model, the full spinal model over my right shoulder, that we've got a disc, a vertebrae, a disc vertebrae, all the way down to your tailbone. And so these shock absorbers are crucial for us. They help us with mobility. They help us with stability. They help us reduce some of the forces of gravity that's pushing us down, not to mention our ergonomics of the various ways that we use our body. So check this out now. I found a cool article just yesterday. So I don't know if you've ever heard this, but let's say you have a long day at the office, you're on your feet all day, and these are your discs. Again, this is going to be the front. Follow my cursor. Over here by me, that's the front of your body, and in the back, that is the posterior. This is the tailbone. This is your lumbar spine. This is number 5, 4, 3, 2, 1. Remember I said there's 5 low back vertebrae, and this is the most problematic area of the spine. Here is it without this coloration. Here, this is what the spine looks like with the discs sandwiched between. All right, so we want all these discs, when we take an image, this is an MRI, these images, we want all the discs to be about uniform in thickness. Yes, yes? So you can see that there are some deviations, but by and large, they're about the same thickness. This is a really nice one here. And that center, the way the MRI depicts, the way it captures the anatomy, the center of the disc appears white, as does this area back here. And so this is where the spinal cord and the spinal nerves live. Everything that is water, has a high water content, is white. So we've got your cerebrospinal fluid back here, where all of your spinal nerves live in that area. And then what else is white? Well, we got some of this material put back here. That's fat and fascia. There's a lot of water in that. And then in the center of the discs, which are comprised primarily of cartilage, we've got this soft area that, remember I said it's analogous to the jelly in the donut. So look at the jelly in the donut. Think of the jelly as a high water content area, usually depicted at the center of the disc. You see when we color it with this unique imaging modality here, red in these images is water content. So it's almost like the jelly in the donut. Imagine a nice friggin', ooh, I love a friggin' jelly donut. I never eat that shit because it's bad for you, but you know what I'm saying? We've all had it and it's delicious. Powdered or unpowdered, I don't really care. It would have to be a really special occasion for me to indulge. But I remember what it tastes like. It's friggin' delish. All right, so the point is here. This behind my emblem here, or my friggin' logo, it says morning and evening. So in the morning when you wake up, there's a lot of water content in the center of your discs. The nucleus, or the jelly in the donut, there's a lot of it. Because while you are not loading your spine and your physical body at night, imagine your body rehydrating these discs, or imbibing. That means to drink in. So imagine like a sponge. At night, the sponge has no pressure on it. It's going to, that disc is going to imbibe or drink in some water content, and it's going to rehydrate. So when you wake up in the morning, you actually might be taller than at the end of the day. This, in the evening, when you've been out using your body all day and standing, sitting, whatever you're doing, gravity pressing us down, look at how it pushes the water content out of the intervertebral disc. So if we're thinking about a shock absorber, and the center and the disc anatomy being what it is, said, if we've got more water in the disc, it's going to be more resistive of compressive forces, arguably, in the morning than at the evening when there's less water in the disc. So that's pretty cool. Interesting factoid is that if you wake up in the morning, you will be, a couple centimeters, you'll be somewhat larger, taller than at the end of the day when the water content has been pushed out of our discs. So that's pretty neat. You can also extrapolate that to people that will tell you that they lost vertical height. So as we get older, all of our tissues, our anatomy will start to suffer. It will start to get old and worn out, just like the parts on our car. The only difference between our bodies and these mechanisms, like something mechanical that man built, is that our bodies can heal themselves. But, with however many cellular reproductions, everything will start to get in a state of decline. It's called getting old. You'll get a little bit shorter. And so that part of that is that these discs will start to desiccate or dry out. And there's also a reduction in bone mass. All right. So that's a condition called osteoporosis, or if you just have a slight reduction, it's called osteopenia. So your spine actually does get compressed, and the water that's in the discs, the jelly in the donut, is typically in older folks a lot less. So this particular article was talking about the effects of weight training, and does weight training do any harm, in particular to the intervertebral discs. Now, they found that there was no long-term issues with discs. I mean, obviously, if you're a friggin' power lifter and you got 1,000 pounds on your back when you're squatting or deadlifting, you will most certainly sustain damage to the discs and the spine. Now, if you go to the extreme, now when we exercise, they say what's good for your body, weight-bearing exercise for bone mass and stuff. The loading and unloading, I will make the case that the loading and unloading of the spine, getting up every day, the anatomy being what it is, we can actually think of a sponge-like action. When we hit the rack at night, we drink in fluids, the discs imbibe, all the tissues are given an opportunity to heal and restore themselves. And then at the end of the day, we're pushing it out. So is that pump action actually good for the discs, the loading and unloading? And I would wager that it is. I don't have hard science on that, but it's kind of common sense, right? Now, if you look at, we're going to be looking at some images where there's disc degenerations or herniations. What is a slipped disc in the lay term, using the lay term, or a disc herniation? So look at the hydration level of these discs. I said we want them to be evenly thick. So when I look at an MRI, I'm looking at how uniformly thick are these discs. On this particular MRI technology, how much hydration is there in the disc? So we would expect a disc that's been degenerated or is in the process of degeneration, that nucleus pulposus will start to not look as clear and defined as this. So we look at, this is your last disc right here following my cursor. That is called L5, the spinal level, L5, S1. This is the fifth lumbar, and this is the sacrum. So if you look at the colorization, if that's even a friggin' term, you can see that there's not as much hydration here as there is in the levels above. And that makes sense because L5S1 is right at the center of your body. It is the recipient of a whole lot of force. And so if it was like a bushing or some part like a spacer in a machine, then it would be a very high wear and tear area. You follow what I'm saying? Let's look at some disc herniations. So here we go. Right next to my image here, you can see that we've got the spinal levels outlined. So this is the L1, L2, L3, L4, L5. And then this is the sacrum. You see it starts to get very curvy. The sacrum is comprised of 4 or 5 fused vertebrae. Okay. So when our tails fell off, the tails would have been right at the end of our sacrum there. If somebody falls and breaks their tailbone, it's usually a matter of the coccyx, this little rattlesnake rattle looking thing at the very bottom. So look at that. So that's the low back or the lumbar spine. And we've got the vertebrae or the bones are square in appearance. And then we've got the discs in between them, and look how uniform they are. And then one of these things is not like the other. Check this out right at L5, S1. This is we can call this the L5, S1 spinal level. And the L5, S1 disc is right here. And we see there's this little booger that is pushing posteriorly. Now, again, I said this is the spinal canal with the cerebrospinal fluid bathing the friggin' spinal nerves, and the spinal cord ends right about here. And so if you've got a disc herniation, some disc material that presses posteriorly like that, it can press directly on those nerves. And that jelly can squirt out of the donut and cause problems back here. If you pin down one of those nerves, you can have, patients are going to present with significant back pain, leg pain. In serious cases, they will have weakness, numbness, and tingling, shooting pain down the leg. Almost like my description is like somebody took a rubber band from your butt cheek or from your low back all the way down to your heel. And if you try to do a hamstring stretch, that is just put your heel up on a bench or something and bend forward, it would hurt like a bugger. That's called nerve root tension. So the mechanics of it again are the jelly squirts out of the donut, wear and tear here, either due to a serious injury, like an acute injury, a car accident, a fall, a work-related, a lift and twist. You can herniate a disc like that on the spot. More common is that an area will degenerate and disc material over years, perhaps decades, will start to bulge out the posterior, and it can even be what's called an extrusion, is where that booger actually squirts out, the jelly squirts out of the donut and starts floating around in the spinal canal. You don't want that. That's a bummer. So over here to the right, we've got the same anatomy, and they're illustrating what I just said. L5, S1, here's the herniation. And so a problem here could cause low back pain, sciatica, calf muscle weakness, shin muscle weakness, butt cheek, excruciating pain into the glute, the butt, the hamstring, leg, and foot. I don't know what the hell that was. There's all kinds of presentations that could occur, but this is the most common area. So I've got one more image here I want to share with you. Check this out. This is a zoomed in spine, again, on the low back. This is number L2, L3, L4 vertebrae, L5. And those look like little marshmallows or squares. And here are the bones that are resting against my seat right now, the spinous process. And then here are the discs. And so if this disc material pushes posteriorly, you can see the spinal cord ending here and these dangling nerves that they call the cauda equina, means horse's tail, because that's what it looks like the strands of hair in a horse's tail. These are spinal nerves that dangle down, and they're going to exit, as I showed you on the model behind me, left and right. And you can think of those nerves that are coming out off the spinal cord there as like wires. And the wires, they power things. They'll give you strength to your calf and your hamstring and your glute. And your quadricep muscle, all the muscles of the lower body. They'll also gather sensation about our sense of touch, right? That's why people say, ooh, I got like numbness and tingling. Why is that? Because we've got incoming information coming through into the spinal nerves about touch, and pain and temperature and things. And then we've got outgoing information that powers things, just like wires do. So you think of those nerves that live back here in the spinal canal as little electric wires and bundles of wires. Pretty stinking cool. So treating, let me go back to this one here. So what happens? Somebody's got, that was a lot of technical stuff, maybe more than most people need to know, but why do I break it down in such detail? Because there's a lot of people that know only a little bit about their body. And I figure if this is we need like an owner's manual. And that's my mission, is to try to provide you an owner's manual for your body. And so when something goes wrong, you can understand it, and you can listen to your body, and you can know a little bit on your own before you head to the provider. You can have baseline knowledge as to your health, which we should all have, right? We should all have the equivalent of an owner's manual for your body. So you know how things work, you know what happens when things break down a little bit, and you know which doctor to consult. So patients all day long are coming in here for treatment for this particular condition: disc herniations, low back pain, sciatica, neck pain, headaches. What do we do? So I've got this model here. What I do as a doctor of chiropractic is that I am like the mechanic for your body, in particular, your nervous system and your mechanical system of the body. So your mechanics, your skeleton has certain ranges of motion, and the spine is no different. So we've got, flexion is where we bend forward, and extension, and turning right and left, and side bending right and left. Those are the 6 spinal ranges of motion. And so when those ranges of motion are lost, there can become the mechanics of the spine become funky. They start to break down. There's an imbalance. And so what I do is, with my clinical know-how and my knowledge of anatomy and physiology, and with these hands and courtesy imaging modalities that I just showed you, x-rays, MRIs, orthopedic tests, I gather information, I figure out what's wrong, and I put together a plan to fix you up. And the tools that I have at my disposal are spinal manipulation, which is a very gentle mobilization of the joint in such a way that you restore the mechanics and balance things out. We stretch, we traction, we rehabilitate, and otherwise bring the body to a healthy balance, which is the name of my practice. All right. So treatment is painless. And in fact, it feels really stinking good. And a lot of patients get on the table thinking that they actually feel halfway decent. And then I start working on them and they're like, ooh, I didn't even realize that, but I'm sore all over from whatever, spring cleaning, yard work, an injury. So we connect with the patient, we listen to them, we gently restore mobility and alleviate pain without drugs and surgery. That being said, if at any point in time we treating a patient, we run across an obstacle, let's say it's appropriate to refer, or we need to order X-ray or MRI, we absolutely do that and refer to orthopedists, physical therapists, personal trainers, you name it. And so that is our method. And I've been in business for 20 years. I love what I do. And every day I'm excited to come to work. So now you're armed with this knowledge, and I'm going to be back again teaching about other things. I got a lot to say. All right. I hope that you tune in, tell your friends, kick ass and take names.